people were starting to just say, you know what, I've had it. And when you say I have it, leaving wherever you are and going outside without a mask. And I think what we have to communicate to people is you actually can start in areas where the prevalence or the amount of virus that's spreading is not very high. You can safely go out, but you still have to do everything that we were talking about. You still have to wear the mask. You still have to do the social distancing. And I think people need to understand how scientists need to understand how it spreads a little bit better for them to really understand this. We're actually working on a piece about it for CBS Evening News. I spoke to a woman who's a PhD, Dr. Prather, at UC San Diego, who actually studies aerosols and is really trying to get the science behind how this thing is spread.
I have a slightly different perspective on this, but that I want to throw out at you just for the sake of scientific debate. I spoke to the Deputy Director of CDC, Jay Butler, yesterday, interviewed him on the radio, and his sense of this is as follows. And I know the person you're talking about at San Diego who you're interviewing is a top person in this field, and I realize she's an engineer and she's studying aerosol. The Deputy Director of the CDC, who's an infectious disease specialist and a pediatrician and a medical doctor in public health, I mean, there's no, part of the problem here is there's no final word on a lot of this. And as you just said, as part of the lead into my question is, we're learning. And his point of view is that he thinks that the virus is largely spread by respiratory droplets, maybe some degree of aerosol, but CDC is not yet convinced of that being a major factor. He thinks that the major issue is social distancing, and I'll get to that. When I finally ask you a question, John, I'll get to where I'm going with this. He thinks the purpose of masks may have been misperceived by the public. I think he was behind the change in CDC's recs on masks. He says the purpose of masks was originally to decrease spread from a symptomatic person who was coughing or sneezing to others around them, not the other way around. It doesn't really protect against incoming. But what CDC has learned is that the asymptomatic carriers, to some extent, have a fair amount of virus in the nasal passages, whether they're symptomatic or not. And there's so much asymptomatic spread going on. And there's people that spread it with mild symptoms. The CDC's feeling is that everybody wearing a mask, especially indoors, is for something called social control. It's similar to what we use a vaccine for. In other words, people that say to me the flu vaccine doesn't work, I say it decreases the amount of circulating virus and it promotes, less viral spread. So a mask is a barrier. Whatever it does, it decreases the amount of virus around. Here's where my question is going, though, John. I'm more concerned about the social distancing because, as I wrote in my fear book, people that are angry, people that are fearful, people that have an agenda, people that are demonstrating are not going to take precautions. So if they wear that mask, which I just said, I gave it many caveats, but I'm in favor of it. They wear that mask, they're rubbing the mask. They're pounding something. Maybe they're more likely to sneeze. Maybe they're touching their nose, their face more. I think you're the one who said to me, people touch their face so many times during a minute unconsciously. So with no social distancing in a crowd, mask or otherwise, it's a high risk, right?
Yeah, as you're sort of implying with all this, it's a lot of different factors here, and there's no reason to bet on one of them. So, no doubt, everybody is saying you need to be at least 6 feet from people. Why is that? Well, it looks like it's really actually kind of old stuff about droplet spread. If you have large droplets, then the large droplets that say from sneezing, from coughing, or even from talking, if you're talking vociferously, those large droplets can come out and they, because of gravity, will fall within 6 feet or so, 6, 7, 8 feet. That's where that comes from. The smaller particles, say 5 microns, then they come out. They're smaller. The fluid that's in them can evaporate and they can sort of float out. So that's where the whole aerosol idea came from. And certainly, it's really hard to argue now against aerosolization being at least some component of it. Doesn't we don't know what percentage of it is, because if you look at the spread in the choir, for example, out in Washington State, where 45 of 60 people got sick with COVID-19, yet nobody had symptoms. As you point out, you don't have to have symptoms. So that, it's hard to imagine that was spread in any other way than just from them singing and the virus coming out. So to get to what people need to know who are out there thinking, okay, you have all this theory, what am I supposed to actually do? We've always said in medicine, belt and suspenders, right? So if you're outdoors and you're in one of these protests, you certainly should be wearing a mask, no doubt about it. The CDC, though, I spoke to them just 2 days ago about this. They're concerned that people are not wearing the mask correctly, or that they're going to contaminate themselves in putting the mask on and putting the mask off. I mean, when you think about it, if you're saying that the mask is there and it's catching some virus on the outside, then when you touch it with your hands, now you've got virus on your hands. So, you have to wash them. You have to be very careful about how you put them on. Think about what we do with the N95s in the hospital. We're very careful about how we take them off. We put them in a bag to make sure that you don't just take off a mask and throw it on the counter where you're having food, right? You want to make sure. So people need to think about all that, and I think it's a lot for people. Mark, it's a lot for people to think about, and it's very easy and understandable why people throw out their arms and just say, "Oh, the heck with it." But this is no time to relax, and it is kind of a perfect storm for there being another spike right now with everybody being close together the way they are.
You're listening to Dr. Radio Reports, Coronavirus Pandemic, What You Need to Know Right Now. I'm Dr. Mark Siegel, Medical Director of Dr. Radio. I'm a Clinical Professor of Medicine at NYU Langone Health. It is a great honor to be joined by Dr. John LaPook, who I've actually known many years. He's the Chief Medical Correspondent for CBS News. He's a Professor of Medicine and Gastroenterology at NYU Langone Health. John, talk to me a little bit about testing. Here's another example where the public, I think you said it best a minute ago, they're trying to get a unified message, but it's a very complex medical topic. So another thing that Dr. Butler said to me yesterday that's fascinating is, and I think it's something that you know well, which is, at some point, you could continue to test positive with a PCR, a polymerase chain reaction test, which is our state-of-the-art test. You could continue to test positive, but yet no longer be contagious because it's dead virus that you're testing positive on. I mean, put together what we should be doing going forward based on your knowledge and learning and great reporting on this topic. Where are we heading with testing in the United States? Both diagnostic point of care.
That last thing you said was very important. So the PCR, and this is Dr. Holmes from the CDC who I spoke to about this, he told me that, because I was trying to get my arms around the same exact question, he said the PCR test, which looks for genetic material, in the back of the nose, say, or in the back of the throat, but that is looking for genetic material. And if you have a virus that's blown up, and you're just having little pieces of genetic material there, but it's not infectious, it can still test positive by the PCR test because it's just looking for any of those fragments, for the fragments that it can still be there. He told me that they are finding, positive PCRs 83 days, as far as 83 days in one case after somebody had symptoms. So, but on the other hand, they have not had. He told me that they have not been able to have virus, isolate virus that's infectious past day 9. So that's why, they changed their recommendations from saying, remember that about a week ago or so? They changed their recommendations to say, when can you return to work? And if you've had COVID, or you think you've had COVID, and they said you have to have 3 days without symptoms. 3 days without fever, even though you're and not taking Tylenol or something to lower your fever. Your symptoms are improving, and then it used to be 7 days, at least 7 days from your last symptom, from when your symptoms began, and now they said 10. And they did that to give you a little extra because they did find that you could isolate virus that was infectious, meaning that you could take it and infect some cells and it could actually grow. There's always this debate about whether viruses are alive or not. So every time you say the virus is alive or dead, somebody writes in and says viruses aren't alive. Anyway, so now it's 10 days. But I think that point is super important for people to understand. People are caught. My patients are caught between a rock and a hard place when they decide to go the route of having 2 negative PCRs in a row. 24 hours apart at least, as that one way to say it's fine to return to work. The other way is without testing, just the criteria I just said. Well, if they decide to go the PCR route, and I had this with a patient of mine recently, like last week, he's been testing positive for 3 weeks now, and he's feeling fine. And he said, if I had never gotten the repeat PCR, I would be back at work right now. I'd be able to go out. I said, yeah, but that's where we are right now. I think to answer your question, let's pull back the microscope and incorporate testing and public health in answering the big question that people want to know is, when can I go outside and play? When can I go outside? So to me, there are 3 things that go into this when people are thinking about, should I go out? One is, you have to understand that who you're going to go out with. If you're going to go out and be with somebody whoever that person is, remember that you're not just with that person. You're with every person they've been with for the past 14 days, because the incubation period is 2 to 14 days. So that means you're not just meeting that person. Who were they with? They were with their sister. Their sister has a kid. That kid was with a nanny. That nanny was sick. You have to figure that out. That's number 1. Number 2, where in the country are you? Very important, because we're seeing places like Vermont and Alaska where the numbers are relatively low. And so you can go online, and everybody out there, you can Google the name of your state, space COVID-19, and you can drill down. You're going to see these graphs, these maps, where you can drill down to the county level about what's going on right near you. So that's like, okay, where I'm going out, is it very prevalent? Is there a lot of virus? And the third thing is, who are you? What is your vulnerability? Are you somebody, or is the person you're meeting somebody who is in one of these high-risk groups? You're older, or you have underlying disease, you have diabetes and hypertension, or you're obese. So these are all the factors that you have to think about when you're saying, what is the risk-benefit? At the end of the day, there's never going to be 100% safe during a pandemic if you're going to go meet somebody, but everybody has different tolerance for risk. And then ultimately, if you are going outside to meet somebody, you do want to maintain the social distancing. People argue about whether it's 6 feet or maybe more than 6 feet. Outdoors, even if it is aerosolized, it's going to be safer than indoors. Indoors, if you're trying to decrease risk, you probably want to have better ventilation, open windows. If you have recirculated air, that's going to be an increased risk. So you have to think about this. Even this PhD said, you may want to think about, are you upwind or downwind of the person who you're with? At the end of the day, there are some people who have no risk tolerance, and they will not cross the street because they might get hit by a car. Other people, all the way on the other end, ride motorcycles. So most of us are in between that, and you have to decide for yourself, what is your risk tolerance?
John, I love when you said, I don't want to try to make a joke here. We're not really joking much, but when you said you're really presenting the last 14 people you were with, that's the same line we used for sexual counseling during the height of the HIV epidemic in the United States.
Yeah, it's very similar, Mark. It's very similar that you have to think about. And it's the same thing with the incubation period. Remember, somebody could test negative for HIV, and then the next day have an encounter where they pick it up, and they don't test positive. They can have an encounter with somebody who they pick up HIV, and then several days later get tested negative because they're still incubating it, and then go out and have sex and say, well, I just had a negative HIV test, and then yet ultimately, if they're unlucky, it blossoms, they become infectious, and then they can spread it that way. It's very similar to this. So think about it. You could get infected 10 days ago. It's incubating. Let's make it more realistic. You get infected 5 days ago, but you don't have any symptoms yet. It's incubating. And then yesterday, you get tested and you're negative because it hasn't blossomed yet. But this morning, a day after you were tested negative, then you become infectious. And as you point out correctly, we're finding out that there's a great deal of spread before people have any symptoms at all, or maybe they never have any symptoms. So, and then there are these super spreaders, right? Where 20% of the people cause 80% of the disease, or something like that. So, I think people need to understand it's confusing, that 2 to 14-day incubation period. That means you're infected, it's inside you, but you're not yet having any symptoms.